So PARP inhibitors are poly-ADP ribose polymerase inhibitors, known as PARPs. They're used in gynecological cancers for maintenance therapy, recently approved. And what that is when patients have double-stranded DNA, the DNA can have a single strand break. Usually, patients will have a BRCA gene that comes and fixes that break. PARP inhibitors were first used as a trial in patients with BRCA mutations, BRCA1 and 2 mutations, who are females who have a deficiency that have a higher risk for both ovarian and breast cancers. When you have a BRCA deficiency, you do not have the ability to repair DNA as effectively as someone who doesn't. So within their cancer cells, which is specific to ovarian and breast cancer cells, when they have a single strand of break with the BRCA can't be there to fix that single strand break. So what happens is the cancer cells, who is trying to grow and repopulate their DNA, calls for a backup, and the backup is PARP. So the PARP will then go and back up and try to fix that DNA, and therefore the cancer is able to grow. However, in BRCA patients, if we inhibit the PARP and block it from responding, then we can potentially kill the cancer cell, because without the BRCA gene, or having the BRCA mutation, which these women have, as well as inhibiting the PARP as a backup plan to help their DNA, then in theory there's cancer cell death. So this was originally studied with BRCA patients with one of the PARP inhibitors called olaparib. It was originally approved for women who had multiple lines of treatment, and it was approved as a treatment and or maintenance after that. And that was a few years ago, back in 2014. More recently, a few other PARP inhibitors, niraparib and rucaparib, were approved in the maintenance setting for these type of patients, with the exception of niraparib that was approved for any patients, or discovered that all women with ovarian cancer would benefit from having a PARP inhibition. And then even more recently, in November of 2018, the PARP was approved in ovarian cancer after first-line treatment. So it originally started as primarily just for BRCA mutated women. We now know that it helps all women with ovarian cancer, whether they have a BRCA mutation or a somatic BRCA mutation, meaning their tumor has some sort of mutation in it, and then also as well as anyone with a recurrent ovarian cancer. I would say I think the importance is in the future for gynecological cancers, using PARP as a maintenance has been sort of a really big breakthrough for us to maintain, like as a maintenance medication, to keep the disease away for as long as we possibly can and have our patients have the best quality of life in that time. I think it's very important that this is widespread across the country, because I think that maybe more in metropolitan areas where people are more comfortable using PARPs, it's more prevalent. So to spread the word, especially with nursing, to educate our nurses to feel comfortable with this type of medication and this use of a maintenance treatment after chemotherapy. So not everything is just chemotherapy and done. Also, it's important to know for nurses that the PARP is a targeted therapy, and the target is quite specific to the GYN cancer in the recurrent setting, and so that they become more comfortable with knowledge of what a PARP is, and that the adverse effects, once worked through, they can be maintained and hopefully resolved, and that it just improves their quality of life.